According to recent studies, more than 40% of Americans have trouble obtaining and understanding basic health information. Here to tell us more is Dr. Shad Marvasti. Welcome, doctor.
Thank you.
So first off, this is Health Literacy Month. So why is it so important for us to understand basic healthcare information?
Well, it's critical. Health literacy is the ability for individuals to not only find information about health, but be able to understand it and then use it to take actions proactively for their health.
So is the problem access to the information or just understanding it? Or maybe it's a mixture of both?
I think it's a mixture of both, although the internet has definitely exploded in terms of all the different stuff that's out there, but there's also a lot of noise, right? And then there's also misinformation. So I think that's where it gets a little bit confusing. And in medical school here at the University of Arizona College of Medicine, Phoenix, we make it a point to train our medical students not to use jargon, right? So that's one part of it on the medical side, right? We don't want to just throw out terms, throw out statistics without trying to explain it in ways that patients can understand, and then really engage them in that decision-making process. We want to be able to empower you with the information that you need.
So speaking of empowerment, what can we do as patients to increase our health literacy?
Yeah, one of the most important things is when you're at the doctor's office, you want to ask questions. You want to, if you don't understand anything, don't be shy about saying, look, I don't know what you mean by that. The other thing that I always encourage patients to do is to bring a loved one with them. Because two heads are better than one, right? Having more than one person there, being able to take notes, right? And be able to compare those notes and then actually, repeating back to the doctor saying, hey, did I understand this correctly? So what you're saying is this. So all those kind of strategies I think are really useful. And then, being able to, do a little bit of homework before you come in. You can read about it, but then ask for health education information. Most clinics and offices will have, accessible, easy to understand information, patient education handouts. So you want to ask for those and make sure that you understand them, and hopefully they're available in the language that you speak as well.
So doctor, how does misinformation play into all of this?
Unfortunately, we saw this play out in great detail in the pandemic. People have there's different health trends that are always, on any social media platform. So really, I think looking at the source of that information, coming back to your doctor's office, being able to have access to really good primary care is really important so that you can have that dialogue and be able to kind of vet whatever information you get.
So we do, of course, have access, at our fingertips to loads of information. Is there such thing as having too much information to where, we become overloaded?
I think so, and I think that's where your primary care physician comes in. Really, you have to look at them as their quarterback, and I think that will improve health literacy and outcomes overall, is if we can get more access to everyone to have a primary care doctor, to be able to make sense of that information. And if you don't have that, then that's really problematic.
So Dr. Shad, any final tips, advice on how we can be better health advocates for ourselves?
Well, I think the key is to ask questions, okay? Know that you have a right to ask questions and to also ask for clarifications. Bring a buddy, bring a family member to any patient visit that you have with the doctor. And when in doubt about something you see, find a primary care doctor, establish a relationship with them, and ask those questions there so that you can have a good understanding from someone who knows what they're talking about and not just trust whatever trend you see online. And if the organizations that are out there in healthcare also does everything they can to provide understandable, accessible health education for patients, we're all going to get towards this goal of health literacy. We're going to work towards it together.
Dr. Shad, thank you so much. This is such great information. If you'd like more tools on how to increase your health literacy, just head over to the website.